Some of the very common misconceptions about joint replacement surgery stems from the patient's experience oftentimes with other relatives who may have had the surgery 5, 10 years ago. Back then, the techniques were different, the experiences were vastly different. The pain control was different. Patients often went to rehab facilities for prolonged periods of time. They spent a lot of time in the hospital, and they truly struggled. The way I tell my patients today, a lot of things have changed, and for the better. And you look at it as a new lease on life, where you struggled before to do what you wanted to do on a daily basis, and now you can't. This allows you to renew your life, so the later part of your years can be truly enjoyed. When we do surgery these days, pain is almost like a soreness more than disabling pain. You're often in the hospital for anywhere from same day to maybe 2 days at the tops. You go home. Rarely, if ever, do patients ever go to inpatient rehab facilities. Our infection and complication rates are minimal, and our outcomes are very good. Oftentimes, I tell patients about a month and a half to get rid of their assistive devices and to get back to their lives. Driving, about 2 to 3 weeks. So a lot of things have changed for the better. And so a lot of times, these misconceptions I go over in detail with my patients. So a lot of these unknown worries are put behind them. So if you're that patient who's struggling with pain from hip or knee, osteoarthritis, but you're scared and you've been told that you need a hip or knee replacement, now's the time to call our office. Let's have a conversation at the minimum, and let's go over these concerns. Small incisions, less pain, and a new lease on life, and now's the time to act on it.